This is a statement of His Excellency President Muhammadu Buhari, President of the Federal Republic of Nigeria, being presented by Dr. Osagie Ehanire, Honorable Minister of Health. The Right Honorable Boris Johnson, Prime Minister of the United Kingdom and Northern Ireland, other heads of government, members of the diplomatic community, heads of international organizations, honorable members of parliament, members of the press, ladies and gentlemen. It is a pleasure to be a part of this Global Vaccine Summit hosted virtually by the Prime Minister of the United Kingdom, Boris Johnson, and I would like to thank the government of the UK for your support and progressive partnership with the Federal Republic of Nigeria, not only in the health sector, but in broad areas of human capital and socio-economic development. I also wish to warmly appreciate the support of governments of the United States of America, Germany, China, the European Union, and other nations to Nigeria in diverse areas, especially during these challenging times occasioned by the ongoing COVID-19 pandemic. I acknowledge the sustained support of Gavi to Nigeria since 2001 towards provision of vaccines for eligible children, as well as financial and technical support from the Bill and Melinda Gates Foundation, the World Health Organization, UNICEF, World Bank, Aliko Dangote Foundation, and others to strengthen our immunization and primary healthcare system. Although we are faced with multiple micro and macroeconomic challenges, Nigeria continues to prioritize the health of our citizens in line with our commitment to achieving universal health coverage by 2030. We have committed $1.9 billion to match $1 billion committed by Gavi to finance vaccines and health system strengthening efforts in our country from 2018 to 2028, as outlined in Nigeria's strategic immunization and primary healthcare system strengthening. We are proud to inform you that Nigeria released 100% of the budgeted 2019 funding requirements for vaccines in line with our joint commitment with Gavi. We also take pride in the fact that in few weeks' time, Nigeria and Africa will be certified polio-free by the World Health Organization and the African Regional Certification Commission for Polio Eradication, and it is against the backdrop of this milestone that we have developed a post-polio eradication primary healthcare strategy that will enhance our ability to achieve universal health care by 2030 in line with the Sustainable Development Goals. The COVID-19 pandemic has clearly demonstrated the need for all countries to review and strengthen their public health systems and the fundamental need to work collaboratively on a global scale. It underscores the importance of international cooperation in promoting the health sector across all countries. As a country, we are putting measures in place at all levels to control the transmission of COVID-19, and we are confident that we will prevail. As the pandemic evolves, it seems increasingly clear that COVID-19 will be with us for longer than we imagined, and in the end, we foresee a situation where we shall flatten the curve but some low-level transmission may continue in communities until we are able to develop an effective vaccine. On this note, we have charged our research institutions to collaborate with the global body of work that is currently ongoing to develop candidate vaccines. And with a population of over 200 million Nigerians, I believe this collaboration is essential because the need will be as great for an eventual COVID-19 vaccine as it is for the routine immunization against well-known vaccine-preventable diseases. I wish to use this opportunity and platform to reassure the international community that we are unwavering in our determination to sustainably sustain our national health system, especially immunization, across all levels of governance in Nigeria. My government is driving accountability, transparency, and synergy in the utilization of scarce resources to achieve optimal impact, not only in the health sector, but across all sectors, including education and social development. While we work towards self-sustainability in the coming years, we will continue to ensure value for money for all resources received from well-meaning governments, donors, and individuals who are committed to supporting us in improving livelihoods of Nigerians. While we appreciate support for our country, we shall continue to look inwards to identify and prioritize initiatives that promote self-reliance for a stronger, healthier, and more prosperous Nigeria. I thank you for your attention.